It's time now for our weekly checkup, where we discuss the latest health headlines you may have missed, aka non-COVID headlines. NBC News senior medical correspondent Dr. John Torres joins us now. Good morning, Dr. Torres. I love this segment. I think it's really important to make sure people know other health news that could ultimately save lives, like this first one I want to ask you about, lowering the age of colon cancer screening from 50 to 45. What's behind that change?
And you're right, Savannah. I think most people are sitting there going, wait a minute, there's non-COVID health news out there? But there is, and there'll continue to be. So we want to cover some of that. And this first one is about lowering that age of colon cancer screening. As most people know, it's been the age 50, which has been the time period where they said you need to start screening for colon cancer. Well, now they're saying that 45 is the new 50. This is a government entity that makes the guidelines. 45 is the age they say you need to start taking that cancer screening seriously and start doing it. Number one reason, because colorectal cancer is the number 3 cancer killer in the U.S. And now we have found out that that 45 to 50-year-old age group has a higher risk. Their risk is the same as that 50 to 60-year-old age group. And so that risk seems to be lowering by the decade. And we want to make sure we capture those early, because when you get colon cancer screened early, it's more likely to be a successful screening, successful treatment. Also, because the USPSTF, this is the entity that now lowered it to 45, insurance will now cover those screenings starting at the age of 45. So what are your doctor's orders? Well, first and foremost, number one, you want to talk to your doctor about getting screening once you get to the age of 45. There's a variety of tests you can use out there. There's stool-based tests and colonoscopy, but colonoscopy is the most recommended if you're at higher risk, even under the age of 85, meaning you have a family history, particularly if you're African American. Then talk to your doctor if you are in those categories, because you might need to start earlier, and that's something you need to work on sooner rather than later, Savannah.
Yeah, absolutely. Important warning.
Dr. Torres, I've got one for you here. A study that shows secondhand smoke can harm a fetus. What more can you tell us about that?
And Joe, you're right. And this is a study I think is taking a couple of people by surprise. We know that secondhand smoke can affect us almost as much as firsthand smoke. Firsthand smoke is me smoking. Secondhand smoke would be somebody in the room if I'm smoking. But what we found out is children, the developing fetus, can be affected by secondhand smoke as well. And particularly, they can be affected to the point of having decreased lung function by the time they turn age 6. And this is seen even with minimal amounts of that type of smoke exposure. Wow. So what are the doctor's orders here? Well, the doctor's orders are fairly simple. Avoid people that smoke around you. You want to make sure that you aren't near anybody smoking, even somebody in the house that casually smokes, because they found out even minimal amounts of exposure can cause an issue. And then, of course, the biggest one, don't smoke, not just for the fetus, but for you as well. One of those big things you want to quit, Joe.
Wow, that's a scary one. All right, this other one that we teased, I'm sure people were wondering about. There might be some truth in the phrase working to death. A study suggested long hours could lead to an increased risk of heart disease and stroke. I'm sure a lot of people have been having trouble separating work from home life during this year. So tell us what we need to know here.
Especially during the pandemic, Savannah, you're right. We've been increasing our work hours because we live in our office, basically. Yeah. And this is the first global analysis. The World Health Organization did it, looking at how much work affects your health, and particularly affects stroke and heart attack risks. And they found out that 35% higher risk of having a stroke, 17% higher risk of having a heart attack if you work 55 or more hours, particularly if you start doing that in your middle-aged years, even down to the age of 45 and above. Working those hours can really increase your risk of having, again, a heart attack or stroke. So what can you do with that? Well, first and foremost, acknowledge the fact that if you do work more than 55 hours, you want to try and share the workload as best you can with fellow employees, if that's possible. But also, if it's not possible, realize that you're at a higher risk of heart attack or stroke. So do the other things you can do to mitigate that. Eat healthy, exercise, get better sleep, of course, stop smoking. These things can help counterbalance it. And then talk to your employer if you can and agree on a maximum number of working hours with employers. And, you know, there's a saying I've always heard that I always went by earlier in my life. And somebody once told me that, you know, on a person's deathbed, they never once said, I wish I had worked more. And so remember that, because you want to work as least as you can, still do, you know, the things you need to do, but at the same time, watch your health. Dr.
Torres, the doctor's orders getting deep today. That was a good one. Thank you so much. Really important information there, Doctor. We'll see you soon.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here. And click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.